for caregivers. It's all about Alzheimer's and dementia, and it gives you lots of tips and explains definitions. And it's very useful and very helpful. So it's going to be yours for free just for calling. So stay tuned for that, because we're going to be giving that away to you just for asking. So today I have a special guest. Right now we have the Alzheimer's Association. It's the Southeast Florida chapter. And for the first part of our show, joining me is Emma Nestler. Hi, Emma.
Hi, Marcia.
Thanks for being here.
Thank you so much.
You're welcome. I'm so happy to have you today, because we just talked about the 36-hour day, which it's named because caregivers try to fit 36 hours or more into a 24-hour day. It's very difficult, as you know. You work with the Alzheimer's Association. So there's something called the longest day.
Yes, there is.
And that's why you're here today to talk about the longest day. I will tell everybody that the longest day itself is coming up exactly 1 month from today, on June 21st. But tell us, Emma, what is the longest day?
Of course. So the longest day is really an opportunity for people to come together through any kind of activity of their choice to help us raise funds and awareness.
So it's a fundraiser.
It is a fundraiser, yes. And so it is based around June 21st, so the longest day of the year, the summer solstice. But one thing to note is you don't have to participate on June 21st. You can really do it any day you want, but it's that one day that the association calls on people around the nation to come together. And so people can do any activity that they want, from a bake sale or a bowling event or karaoke to a silent auction. It's very flexible and creative.
So you're the development manager for the longest day.
Yes.
With the Alzheimer's Association here in Southeast Florida. And you've been doing it now 2 years. And I understand it's a full-time job. So it's a one-day event. How does it take a whole year to prepare for one of these events?
Good question. So I spend most of my time being out in the community and meeting with people and coaching them through the process on how to have their own longest day fundraiser. So I do a lot of recruiting for different facilities in the area, different friends and family, companies, membership organizations. So I'm working with these groups all year long to coach them through that process.
Okay, so you're recruiting volunteers, so to speak, to participate every year on June 21st or around that time to raise funds. Now, what are these funds that are going to be raised? What are they used for?
So they are used for our care support and research. So it funds all of our programs and resources we provide free to the community, and also goes to research as well.
Okay, good to know. People would want to know what you're raising money for,
question.
right? And for the Southeast Florida chapter, what counties does that encompass?
So we are all the way from Vero Beach down to the Keys. So Indian River, Martin County, St. Lucie, Okeechobee, Palm Beach, Broward, Dade, and Monroe County.
Wow, that's a big territory.
It is.
And that's what you're in charge of?
I cover that whole territory.
Okay, so I understand now why it takes you a whole year to prepare for the longest day event every year, because you do have a lot of territory to cover.
I've been on a tour of South Florida since November, so it's been fun.
Wow. So getting back to the longest day, I know that it's held around and about June 21st, because that is the longest day of summer. But is it also related to the fact that caregivers have long days?
Yes, it is. That's how. So the longest day started as a national campaign back in 2012. And so it's very new still. Our walks have been around for many years, but they brought it on to be an additional kind of fundraiser. And so they started it out as a sunrise to sunset event. So based around the struggle of the caregivers, that really every day is the longest day for them.
Okay, so, but now there's a little bit of leeway around that, because obviously one day of the year is hard to plan all the events. And so your job is to recruit. Now, people listening to this, right? And they are thinking, well, I want to get involved. I want to do something. How would they know even where to start? Do they contact you for that?
Yes, they absolutely can. And they can also visit our website, which is alz.org/the longest day. And really, to start off, think about different hobbies that you already love to do. Or think of something, if you've lost a loved one, what did they used to love to do? You know, I have a team that her grandmother taught piano, and she had a piano studio outside of her home. And so every year they do a piano practice-a-thon. So all day they play piano at a hotel, and past students come and they take turns playing. So it can be something very meaningful.
That's a great idea. Do it around something that your loved one liked to do. Sort of like a tribute to them. And then if they play the piano, people give them tips and they collect the money.
Yeah, something like that.
That's great. I love that. So people can either do it as an individual effort or as a team or as a family perhaps. Or as you mentioned before, you go into communities like memory care communities, assisted living communities, independent communities, and get them to be on a team.
Exactly.
How hard has it been to recruit people?
It's some days it's really easy, and some days it is hard. I will not lie. Because Longest Day, it's a very special event, and it does require some effort on people's parts. So it really takes a person who is passionate and dedicated to the cause. But one thing to note is it doesn't have to be a big, grand event. It can be something very small as, on this day, I'm going to spend the day gardening in honor of my grandmother and ask for donations from my friends and family. And it can be something as simple and personal as that.
Well, that's really nice. People can just make donations to you to help you raise funds.
Exactly.
Okay, I like that. That's really, really nice. Can they call your chapter and ask for you if they want more information?
Absolutely.
What's that number?
954-786-1533 is our office number.
Okay, you want to say that one more time?
954-786-1533.
Okay, so if you'd like to join in for the Longest Day, it's coming up exactly 1 month on June 21st. It doesn't have to be that day. What day I think it's a Friday.
It is a Friday this year,
Yeah.
so that is definitely helpful for some people.
I know a couple years ago we had Wear Jeans to Work Day, and it was a Friday. And it was great because we raised money. So if you wanted to wear jeans to work, you had to pay to do it, to be comfortable, and wear your old scrubby jeans. And we raised money that way.
Exactly,
So
which is a great idea.
it's simple. I mean, it's simple. And I know that one of my friends, her grandson made cookies and did a bake sale because his grandmother had Alzheimer's and she taught him how to bake. So he thought, I'm going to bake cookies and I'm going to sell them. And that was a child's way of raising money.
It's a wonderful idea as well.
So it doesn't have to be anything over the top, although I'm sure that Emma would love to see that. And
Absolutely.
she could help you with all of that and the plans. And how can people advertise if they have an event? How can they advertise if they want it open to the public? Can they go through you?
Yes. So if you, say, on Facebook, create an event, you can request the Alzheimer's Association Southeast Florida page as a co-host. So that way, when people are on our Facebook and they're looking at upcoming events, they'll be able to see your event.
That's wonderful. And there is one that is open to the public,
Yes,
isn't there?
it
You want to
is.
talk about that?
Of course. So we have a team on June 23rd, so not the longest day. They are doing a comedy show benefiting the Alzheimer's Association for the Longest Day. And it's going to be Sunday, June 23rd at 6 p.m. at Robot Brewing. And so if you want more information about that, you can call me and I'll give you it.
Oh, that's awesome. What town is that brewery in?
It's in Boca Raton.
It's in Boca, so it's right here in South County. Sounds like a fun time, a good event. Call Emma. You want to go to the brewery and have fun and laugh a lot. We always say here, if we're caregivers, it's really important to keep your sense of humor.
Exactly.
So you can go and laugh and have a good time and raise money too. So love that. Thank you. We're going to be talking more with Emma as soon as we come back from our first commercial break. So stay with us.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. You are listening to your host, Marcia Teal, an Alzheimer's disease and dementia care expert on CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
Welcome back to Caregiver Solutions Info Show. My special guest today is Emma Nestler. Emma is the development manager for The Longest Day with the Alzheimer's Association Southeast Florida chapter right here in South Florida. And Emma, thank you again for being here. We're talking about The Longest Day, which is coming up on June 21st because it is the longest day of the year, right? But it also represents the fact that it's a long day, the longest day for caregivers because they never stop caregiving. Even when they're sleeping, they sometimes sleep with one eye open and one ear open, looking and waiting and watching and listening for the person they're caring for. So it's a way to honor caregivers and a way to raise money for the Southeast Florida chapter, The Longest Day, although they do it all across the nation, right?
Yes, they do.
It's a national program. So good luck with that.
Thank
you. I wish that everybody will do something, do their part, big or little, doesn't matter, to participate and raise some funds and awareness for The Longest Day. So we talked about, before commercial, the fact that Alzheimer's Association is more well-known for their walks.
Exactly.
Right? And before you became the Longest Day development coordinator, you worked on the walks. So let's talk about the walks coming up. I know we have a couple of them here in Palm Beach County. We want to give those dates and talk about how people can get involved with that and talk about how people can represent their loved one with a walk. I know a lot of people have walked, but many people have not. And that's because every 60-some seconds, somebody else is diagnosed with Alzheimer's. So there's always new caregivers every second being born, so to speak. So we want to continue this momentum every year, push the walks, push The Longest Day, push this awareness and this advocacy for doing something about Alzheimer's disease.
Exactly.
Yeah.
And you make such a good point. We need to keep talking and talking and talking about this disease so that people will start listening more.
I think that it's never can be talked enough because, again, people are new to it. Every day there's a new caregiver, there's new people that are being diagnosed, and we also know that there's a lot of people that have the disease who haven't even been diagnosed yet. So they're not even in those numbers that we talk about, which we're going to talk a little bit more about later. But let's go back to the walk. We have some walks planned, and go ahead and give us the dates and the times and where they're at so people can make notes of that.
Okay, great. So in West Palm, if you're in that area, we have a walk on October 28th at the Meyer Amphitheater. And usually registration opens around 7 a.m., and the Boca Raton walk's going to be at Meisner Park Amphitheater on November 10th, and that registration opens around 6:30. And then if you're in Broward, we have a walk on November 9th, which is the day before Boca, at Nova Southeastern University.
Okay.
And you can register for these walks at alz.org/walk. And you just type in your zip code, and it'll show you the closest walk to you.
So again, walking is great because two things. Number one, it is also a fundraiser.
Exactly.
It also is good to walk because one of the best things that you can do for your body and for your mind is walk. And so I love the fact that this started, I don't know how many years ago the Alzheimer's
Not sure.
Association started it, but I know you were involved with the walks for several years and now with the longest day. What is your experience that you've noticed with the walk over the last few years? Do you see any kind of pattern? Is it where people are coming out because they're caregivers or because they knew somebody, or is it both? I mean, tell us about a typical walk. Pick a day, pick one of the events maybe last year that you participated in, and talk about what's a typical walk like, what's involved.
Okay, great. So mainly our walks are made up of friends and family teams. So it could be that they've lost a loved one or that they are caring for someone living with Alzheimer's or dementia. And we also have a lot of companies and businesses that also come and support us, and the different assisted living communities and memory care as well. And so it's a great opportunity for people to come meet all at one place and feel like you're not alone in this fight. And I think that's the most important thing that people get out of it, is that it's a sense of community and that everyone around you has gone through or is going through the same thing as you are.
Absolutely. So about how many people actually show up for this particular walk every year?
So we have about 5 walks. We have another one in Treasure Coast in Miami that I didn't mention. And so it ranges from 1,500 people to 4,000 people at some of our bigger walks.
Wow, that's pretty impressive.
It is. It's wonderful to witness. It really is.
That takes a lot of coordination. And I myself have participated in many of the walks, both in West Palm and in Boca. And I love it. You get up and you get up in the morning and get out there, and they have a kickoff, right, before you actually start walking. They have music, they have sometimes exercises. What are some of the other things they've got going prior to the actual physical walk?
So one of my favorite part about the walks is our Promise Garden ceremony. So we have 4 flowers in our Promise Garden. Each are a different color that represent. Purple means you've lost someone to Alzheimer's. Orange means that you're just, in support of a world without Alzheimer's. Yellow means that you're currently a caregiver. And blue means you are currently living with Alzheimer's or dementia. So during our Promise Garden ceremony, each color takes a turn raising your flower, and it's a very moving experience.
I've witnessed that too. It's very emotional.
Yes.
With all the different colors of flowers, and the flowers are usually like pinwheels,
Yes.
right? And if it's a nice breezy day outside, the pinwheels are going, and it's just so emotional and sometimes wrenching, but people are out there for supporting each other. And by the different color flowers, you know why people are there, depending upon what color flower that they might be holding at the time.
Exactly.
Yeah, and then what we do, bring our flowers back and we put them in the yard, and they have little whirly birds, and they're going, and people say, well, what is that? And then you have a chance to talk about the Alzheimer's Association, the memory walk, and why you do what you do. Yeah, I love that. So people want to go, people want to participate. Tell them again how they can do that.
So you can register at alz.org/walk, and you just type in your zip code, and it will show you the closest walk to you. And it is free to register, and I encourage everyone to make a team and come out and join us.
It's great because we had a team at Arden Courts, and we had employees because they deal with Alzheimer's every single day. The caregivers, they're there, they're in the trenches, they're caring for people that have the memory loss. But what was amazing is that we also had family members join our team. And the family members, they were the loved ones of the people that were the residents, in our community. And they joined, and they fought, basically, to raise these monies because they want people to know, hey, I'm representing my husband. He has Alzheimer's, and will you please donate to the walk? And they were phenomenal fundraisers because they're walking the walk, or they've walked that walk. And who better else to tell about it than caregivers.
Exactly.
And it was just so wonderful to have everybody out there. And one day, like you said, and there's food,
Yeah.
and there's water. So if it's a really hot day, I mean, I know we do it here in South Florida more in the fall.
Yes,
right?
so it's a little cooler.
A little bit cooler. Other maybe chapters throughout the United States may have other months that they do theirs.
They mainly do theirs kind of beginning of October or September before it really starts to snow.
Yeah.
But we don't have to worry about that.
Yeah, we're blessed. We live here in South Florida, so our walks are in the fall, and it still can be warm out there, but it's beautiful. And there's free water. There's all kinds of snacks to keep you nourished and energized, and a lot of fun, a lot of stuff going on. It's just, you have to go. If you've never been, you have to go. You have to go register for the walk, and you have to participate in this year's The Longest Day. And Emma was talking about that. When we come back from our commercial break, we're going to be having another representative from the Alzheimer's Association, the Southeast Florida chapter, and we're going to be talking more about what the association does with the monies that Emma's raising, right? With you and all your friends, and with help from the community, raising all the funds. We're going to be talking about where those funds go, what they're used for, how they're used, and then we're going to talk about some other statistics about Alzheimer's and this terrible disease that we're all trying to eradicate. So stay tuned. We'll be right back. Don't go away.
The inability to recognize the obvious often occurs with Alzheimer's, particularly among the family members who care for them. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to us. We know. We understand. We can help. Arden Courts. Wandering is a common problem for people with Alzheimer's or related dementias. It's also a problem for family members who care for them. Keeping them safe and secure means never letting your guard down. And even though deep down you know it's time, it hurts to have to ask for help. But it could hurt them even more if you didn't. We know. We understand. We can help. Arden Courts.
To your host, Marcia Teal, an Alzheimer's disease and dementia care expert on CareGiverSolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
This is Marcia Teal, Caregiver Solutions Info Show, brought to you by our national sponsor. Our national sponsor is Arden Courts Memory Care Communities, and this is a book that they want to give to you absolutely free. This book is brought to you by Arden Courts. It's called the 36-Hour Day, and the reason it's called the 36-Hour Day is because caregivers feel like their 24 hours a day is really 36 hours a day. This book was written by Dr. Peter Rabins and Nancy Mace, and it's a wonderful resource. It actually has explanations in here, definitions, tips, anything to help you as a caregiver with all of your challenges. This book is absolutely free. All you have to do is call the toll-free number of Arden Courts, which is 888-478-2410. Again, 888-478-2410. Tell them that you heard about the offer on the Caregiver Solutions Info Show, and they'll be happy to get your name and address and make sure that they get a book mailed right to your house. So call today, and you'll be glad that you did. I highly recommend this book. So my guests today are from the Alzheimer's Association of the Southeast Florida chapter, and Emma has been talking about the longest day and the walks, things that you as a professional or as a caregiver or as a family or friend of someone with dementia or someone who just cares can actually raise money and bring awareness to this terrible disease. And joining us now since our break, we have Jennifer Braisted. Hi, Jennifer.
Hi.
Jennifer is the Senior Public Policy Manager of the Alzheimer's Association here in Southeast Florida chapter. Welcome.
Thank you so much for having me.
Well, I'm so excited that you're here because, we talk about Alzheimer's on this show, and we talk about caregiving and how hard it is. And Alzheimer's is something that is just not going away anytime soon, right? Yes. And I know you have some statistics that you share all the time with people when you are out in the field because you are the public policy manager.
Yes.
So first of all, explain what your position, what your job is, and then give us some statistics of what is out there that we ought to know that's going to be, I think, a little bit scary.
Absolutely. So I am the Senior Public Policy Manager for the association. So in my position, I work with volunteer advocates and elected officials on a federal and state level to educate them about Alzheimer's disease and to empower advocates, whether they're caregivers, former caregivers, or individuals who are actually living in the early stages of Alzheimer's, for them to share their stories and advocate for legislation that is going to support them and the millions of individuals who are living with Alzheimer's. Also work on crafting legislation and researching to make sure that we are doing what we can for caregivers and those who are living with Alzheimer's, because as you alluded to, the numbers are substantial and really shocking. So in the United States, we have 5.8 million Americans who are living with Alzheimer's disease alone. So a lot of times when we think of Alzheimer's, we also loop in other forms of dementia, whether that's Lewy body or vascular dementia, but 5.8 million individuals are living with Alzheimer's only.
And that has actually gone up since we started this show a few years ago. We used to say 5.6 million, and now it's 5.8.
Yes.
So the numbers are getting higher, and I don't know if we're getting any closer, but the numbers are getting higher.
Yes, and there are over 16 million caregivers across the country who are providing unpaid care for those loved ones who are living with Alzheimer's. In the state of Florida, we have the second highest prevalence. We have over 560,000 Floridians who are living with Alzheimer's, over 1.1 million caregivers. And, one of the more staggering statistics is that actually in the next 6 years, we're looking at over a 28% increase in the number of individuals with Alzheimer's in the state of Florida alone.
That is scary.
It is. It is.
And it's so scary that, I'm always amazed that there's not more talk or urgency about doing something. I mean, we all are doing our part, but it's like a crisis. This is becoming a national crisis.
It is a crisis. And, in our public policy effort, when we are engaging with elected officials, we tell them this is a public health crisis because as we can see through these numbers, the burden is large, but the impact is also major. Not only is there a huge cost to caregivers, but Alzheimer's is the most expensive disease in the United States too. This year alone, it'll cost over $290 billion. And, a large chunk of that is coming out of Medicare and Medicaid funding. So this is something that our government needs to focus on because it is bankrupting our country.
You mentioned that it's very expensive. And is that because Alzheimer's disease can last anywhere from 2 to 20 years?
Yes, so it really comes down to, as you said, the longevity of the disease, because it can last up to several decades, but also because individuals who are living with Alzheimer's disease are also most likely to be living with another comorbidity, whether that would be high blood pressure, diabetes, which is something else that they need to manage, and of course, when they're living with a form of dementia, and they have that other comorbidity, more issues are going to come up, and that's where the cost comes in.
And if you think about it, it's interesting that it seems that it would be harder to treat someone with, let's say, diabetes or some other disease that also has Alzheimer's, because the person with Alzheimer's may not actually understand what they're supposed to do and what they're supposed to be doing to help themselves get better physically, because mentally, cognitively, they don't quite understand. So I think just that alone
Oh, yeah.
would make it so much more difficult to treat.
Absolutely. And, with that, of course, you're going to see issues with medication management and then just treating the disease itself. So you'll see higher, hospital readmissions rates than readmission rates. So there's a whole host of issues that occur because of that lack of cognitive ability to be able to take care of yourself with those conditions as well.
Yeah, I think when people think about, somebody has Alzheimer's, they don't really think about all the other things that could be wrong with them as we age, because, of course, Alzheimer's isn't just for people that are older, as we all know by now. If you've listened to the show all the time, you know that there's early onset Alzheimer's. They don't know what causes it. They don't really know how to prevent it. They're trying to treat it, but they can't prevent it. They don't know what causes it. So it's really, really difficult for caregivers, because they're not only caring for the person who doesn't have the cognition that they used to, but now they've also have these other, like you said, comorbidities that are preventing them from really being able to get a handle
Absolutely.
on it, to get a good handle on it.
Yeah, because unfortunately, the reality of it is still that we have no prevention, treatment, or cure for Alzheimer's disease. And, just talking about individuals who have younger onset Alzheimer's disease, which, of course, is really 65 and younger, right now we have just over 500,000 Americans in the United States who are living with younger onset Alzheimer's. And unfortunately, those numbers are continuing to rise as well. And as you mentioned, we don't know why that is. There are some that have that genetic predisposition for that, but, there still hasn't pinpointed exactly.
Yeah, and what's interesting, I'm glad you brought that up, because just because maybe your grandmother had Alzheimer's, it doesn't necessarily mean you're going to get Alzheimer's.
Right.
But there's a better chance of it because of the familiarity between the generations, right?
Exactly, yes.
And the scary thing was, I met a lady. I met her when she was 54. She was diagnosed with Alzheimer's before she was 50. And it was obviously early onset. And she didn't live a long time, because the faster it progresses, the younger that you are, usually it progresses much faster.
Yes.
So people that are going to be diagnosed with it as an early age are not going to be living into their 80s, right? And so this particular woman, it was really scary, because when I met her, I was about the same age as she was at the time. And she looked like me.
Yeah.
And she walked like me, and she literally looked like me. She was tall, she was blonde, she had blue eyes, and she was always a very active person. And later, finding out more of her history, I come to find out her parents had 3 children, and she was the youngest, and she had lost her mother to Alzheimer's disease, and she had lost a brother to Alzheimer's disease, and the other brother was also diagnosed with Alzheimer's disease. So when she passed away, this poor husband, father, lost his entire family to Alzheimer's disease, his wife and 3 adult children.
Wow.
And it's devastating. People don't think about that.
No.
But, sometimes it does run in families, but not necessarily, like we talked about, you're going to get it. But in this case, it was just unbelievable. This whole family was totally wiped out. So I became a big advocate, for people to get diagnosed early and get tested and do research, because we've got to find a cure.
Absolutely.
We've got to find what causes this so we can stop it.
Yes.
Because more and more people are getting diagnosed every single day.
Yes.
Yeah.
No, and I mean, that's something at the association we are so passionate about. And one of our huge educational initiatives is to educate about early detection and early diagnosis, because we know that when someone is able to get that diagnosis and have those conversations, one, they're able to get access to clinical trials that are going on. So they could be the one who actually is cured of Alzheimer's disease.
But Jennifer,
Yes.
what do you say to the person who says, I don't want to go get tested. I don't want to do the clinical trials because there's no cure. Why should I put up with that? Why should I go through that? They don't have a cure for it anyway. Even if I did get tested and I tested positive, there's no help. Well, what would you say to a person like that?
Well, I always like to see the glass half full. And, of course, it's their personal decision on what they want to do. But what I would say is Alzheimer's is still, when you think about it in a research standpoint, is still a new disease. And just the breakthroughs that we have seen. I've been with the association for 4 years now. And, just to see the advancements that we've had with imaging, you used to not be able to get a diagnosis of Alzheimer's until autopsy. Now, through PET imaging, they are able to see the plaques and tangles and provide that diagnosis. That's a huge advancement. We are looking at advancements with biomarkers, and yes, we've hit some roadblocks, but everything does. And, I always think about how, penicillin was, it wasn't found the way it was supposed to be. Things happen, and that is why funding for research, we are at an all-time high for funding at the National Institutes of Health. Alzheimer's and related dementias now receive over $2.3 billion. When I started at the association, we were just over $400 million total. I mean, so that is being able to spur so many new research things, projects that researchers never thought they would get the funding for. Now they are. I see the light. We're still a ways off, but, you see the light, and I think that's, the best you can say. And you've got to have hope. And, and when you get that diagnosis, I think being able to plan out, how you want to live through this disease and go through that journey is so important.
And I think that is a great reason, lots of reasons there to go ahead and get early detection and early help, because what you said, quality of life matters. And if you're going to get it and we can't stop it, we want to know how we're going to live and what we want, and to tell our wishes to our people that are in charge, like our power of attorneys and people that have our healthcare surrogate and our families. And we want to be able to talk about that while we still can.
Of course.
Yeah, that's very important. It sounds like your efforts in Tallahassee are working because the increase in the funding has been wonderful.
Yes.
So as part of your job to educate the politicians, tell me a little bit about that.
Yes. So I will say that we have really seen an increase in awareness and momentum when it comes to our legislators, both on a state level here in Tallahassee and also in Washington, D.C. I think that is through, the momentum. And, one key thing that we do as an association is we have our advocates, volunteer advocates, build these relationships with legislators. So they're sharing their stories, they're building that relationship. They're there and they're saying, I'm a constituent, this is what's going on in my life and my family, and this is what you can do about that. And that's a very empowering and powerful thing. So we're really seeing that momentum. Unfortunately, we are seeing a lot of legislators who have been touched by this disease or have friends who have been touched as well, because unfortunately, as the numbers continue to rise, we're all going to be affected by this disease in one way or another. So it used to be we would go in and share our stories. Now it goes, may I tell you my story? And that is a good thing for getting legislation passed and seeing more momentum, but unfortunately that just shows that, this is not going away anytime soon, and we need to do more.
So you've seen an advancement in the awareness
Absolutely.
in the politicians.
Yes.
For two reasons. One, because it's affecting their lives on a personal level, but the fact that you are consistent, right? You're up there consistently telling the message. And I think it's great that caregivers actually are the ones telling their stories.
Exactly. No, and not only caregivers, but individuals who are living with this disease. Because, when someone is, recently diagnosed, and if they can get diagnosed early, they're still able to do many things. And one thing is really being able to share their stories and articulate that, and really give that perspective that, we can't articulate. And it's such a really beautiful and, very emotional thing to be able to witness. It's really incredible. And, with our legislators, they are inundated. There are so many issues in this world, as we know, not only when it comes to healthcare, but transportation and all the things. And I think being a consistent presence, but also providing that education, because, you can't let them think, they know about Alzheimer's, they know about the facts. They don't. They are inundated. So I think building those relationships, and I think that's important for anyone who has a passion project or something that they care about. These are your elected officials, and they need to meet with you and your staff. And I think educating them, as we all know, education is just such a powerful tool for anything.
Absolutely. Well, thank you for spearheading that for us. That's wonderful. We're going to take our last commercial break, and when we come back, Jennifer and Emma are going to share with us some of the services that the Alzheimer's Association provides that you, as a caregiver or a professional, can benefit from. So we'll be right back with more.
Wandering is a common problem for people with Alzheimer's or related dementias. It's also a problem for family members who care for them. Keeping them safe and secure means never letting your guard down. And even though deep down you know it's time, it hurts to have to ask for help. But it could hurt them even more if you didn't. We know. We understand. We can help. Arden Courts. The inability to recognize the obvious often occurs with Alzheimer's, particularly among the family members who care for them. When the time comes for you to decide that someone you love needs more help than you can give, will you be able to recognize it? Don't wait for a crisis to make the decision for you. Talk to us. We know. We understand. We can help. Arden Courts.
Marcia Teal, an Alzheimer's disease and dementia care expert on caregiversolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
Welcome back to Caregiver Solutions Info Show. My name is Marcia Teal. I'm your host, and my special guests today are from the Alzheimer's Association Southeast Florida chapter. We have Jennifer Brasted and we have Emma Nestler, and they're here talking about all kinds of things that people need to know about, between advocacy, early detection, and lots more. And so now, ladies, I'd like to talk more about specifics to the Southeast Florida chapter of services that can be provided to caregivers that they need to know about, and what they can do to help themselves help their loved ones. So, Emma, a lot of people say, go to a support group, right? And a lot of other people say, that's not for me. So it's kind of a thing where is it your thing or is it not your thing? What would you say to somebody encouraging them to join a support group, and why?
I think support groups are so important because it really gives you a group of people who are also going through the same thing you are. And so it really helps you to not feel alone in this process. And we have trained facilitators who are very knowledgeable as well and can offer you guidance and assistance and be there for you through all the different struggles.
A lot of people say, I don't want to go and sit and tell my whole history. I'm a private person. I don't want to share about my husband and the horrible things that he does. So does a support group exist for someone like that, or is it safe for someone within a traditional support group to go and just listen? They don't have to participate as far as telling everything. Is that right?
Absolutely, and you'll never know if you don't try. So I do, encourage anyone who is a caregiver or living with early stage Alzheimer's to find a support group near them and try it out and see if you like it.
And also, you can try one support group and you can try another one. I know people that go to more than one support group.
Exactly.
Because they actually have a connection with the people there. And if you find that connection, that's a great thing because, like you said, you don't feel like you're alone and people understand you because they're walking in your shoes. So some people actually go to multiple support groups. But if you go to one and you don't like it for whatever reason, feel free to keep looking, right?
Absolutely.
I think that's important for people to say, don't judge one support group on one support group. They're all different, right? So you all offer those through the association.
Yes, and if you are ever interested in finding a support group near you, I recommend visiting our website or calling our helpline, which is 800-272-3900.
Okay, so the helpline is good, or you have them listed on your website.
Exactly.
Okay, and that website is?
alz.org/SE Florida.
And Florida is spelled out.
Florida spelled out.
Okay, great. Jennifer,
Yes.
some other services that the Alzheimer's Association provides besides support groups, because I know
Absolutely.
that people really know about support groups, they heard about them, but what other things can you provide?
Yes. So I think, as Emma just mentioned, we have a 24/7 helpline that's available 365 days a year. That is actually manned by dementia-specific experts, and that anybody can call. So if you're a caregiver and your loved one has recently been diagnosed and, you're just having a difficult time and you need to talk to someone, they are able to assist with that. A lot of, people don't call during normal business hours. They're calling at 2, 3 in the morning. Their loved one's getting up, or maybe during the evening their loved one isn't cooperating with them and they're not allowing them to help them bathe. Our helpline specialist can actually walk through tips with them, provide information. It's an overall resource for them. So again, that number is 1-800-272-3900, 1-800-272-3900.
I love that because you're 24/7.
Yes.
Just as you mentioned, so you don't have to worry you're waking somebody up. You're calling
Right.
a helpline. You're going to get the help you need. A lot of people would, I think, want to do that rather than call 911.
Absolutely.
And I think that a lot of people don't think about the helpline enough because they do call 911. But when 911 comes, they can't really do a lot, right?
Right.
I mean, unless someone's actually physically
Right.
hurt themselves or have fallen and they can help get them up.
Of course.
But a 911 call, the paramedics, they're not going to be able to explain to you how to get your husband in the shower if he's resistant, right?
Right.
They're not going to be able to help you in a lot of ways that the helpline can because, that's what they do all the time.
Absolutely.
So I think that it's a great resource for caregivers. I know some people just overuse 911, and sometimes it's like the boy who cried wolf because
Right.
they're calling all the time, and now you've got the paramedics like, oh, here we go again.
Right. No, and the helpline, it really, and those are just a few examples of what can be used for the helpline. I mean, I know individuals who are looking at placing their loved one in an assisted living facility. We can provide and walk through questions to ask and, things to look for when you're actually out there looking for a facility.
Okay.
I mean, even individuals who are, maybe they live alone and they're experiencing some memory issues, we can talk to them about the signs and symptoms of Alzheimer's disease as well. So the helpline is really an all-encompassing tool that someone can use. And
That's good to know because it's not just a crisis line.
Oh, no.
It's just not in an emergency, right?
Right.
It's help.
Yes,
No
it's-
matter what kind of help you need.
it's help at any time. Of course, it is not an emergency line. So if there ever is an emergency, of course, calling 911. But it is available middle of the night, during the day, anytime for really any questions regarding Alzheimer's and dementia. So that is just a wonderful tool. I always like to talk about that first and foremost because
Yes.
people can use that anytime.
That's great.
We also have educational programs programs. As I talked about, early detection and diagnosis is so key for the association. So we offer community programs for individuals, caregivers, professionals on the basics of Alzheimer's disease, the 10 warning signs, healthy living for the brain and body, because we know now through research that there is a correlation between heart health, keeping your body active, and brain health. And we're all about reducing the risk of dementia through the promotion of brain health, effective communications with Alzheimer's, understanding behavior. These programs are free. They are workshops that our staff can and volunteers can provide to anybody in the community as well.
Well, that's great because it's free,
Yes.
right? And it's free to learn. But also, if someone can't physically come, do you have printed material that you could send to people?
We do. So if anyone calls our helpline, they will actually, if a caregiver calls just wanting information, we will actually mail them a packet with all sorts of information on how to take care of yourself, caregiver stress checklist, working on financial planning, all of the things that they need through this journey. And we will mail that to them. Also, caregivers can actually come into our offices. We will provide care consultations where we will sit down with them, go step by step through what they need to know. As you mentioned earlier, power of attorney, that financial planning, which is so critical. We will walk through that with them and provide resources that they need. Also, if an individual is in the earlier stages and they don't need to be placed into an assisted living or nursing home, maybe some home health care, or whether going to an adult daycare, we can provide resources and information on local, services that are available.
Oh, that's wonderful.
Yes.
There's so much
There
that people
is.
can get, and it's all free just for the asking.
Yes.
The point is you have to ask.
Yes.
Exactly.
But, that's where our helpline comes in and our website. They can learn all about Alzheimer's disease on there and really access any of these resources as well.
Okay, I love it. So one more time, give the helpline number.
Sure. So it's 800-272-3900.
And your website?
alz.org/SE Florida, Florida spelled out.
Okay. And please, please, please avail yourself of these services. I want to thank you, Jennifer Brasted and Emma Nestler, for coming today from the Alzheimer's Association of Southeast Florida chapter, right here in our community.
Yes.
Right here, there's so much that they can help you with. So thank you for coming
Thank
today.
you so
Thank you so
much for the
much.
opportunity.
You're very welcome. And to you all, thank you for watching today. Don't forget, call to get your free 36-hour day book. It's absolutely free, 888-478-2410. In the meantime, we'll be back on Tuesday next week, same time, same place. And don't forget, give somebody a hug because they need it and so do you. So we'll see you next time. Take care.
Thanks for joining us for this week's Caregiver Solutions with Marcia Teal. Join us next week as Marcia, who has 15 years of Alzheimer's disease and dementia care experience, brings you more needed information to help with the care of your loved one. This show can be seen again on caregiversolutions.info, and questions can be left on the site, which may be used on the program to help others. See you next week for more Caregiver Solutions.